in studio with us Dr. Naila Edwards, who is an internal medicine specialist, a medical officer, and a geriatric medicine specialist, and she's here to speak to us about the Roxborough Hospital and it being designated as an age-friendly health system, and it's the first time that is being done in the Caribbean. Good morning and welcome.
Good morning.
Good morning. Thank you so much for having me and shedding light on this important issue.
Right, and tell us about how we got here and what are some of the issues that face the aged population that led to the Roxborough Hospital creating a system that is age-friendly.
So I believe we got here when I first started working at Roxborough Hospital, and I recognized that a lot of the community we serve in the East, a lot of the people that have the highest needs that circle in and out of the hospital system are older adults, and that's the case across the board around the world. So Latin America and the Caribbean, it has the second highest rate of aging population in the world. And a lot of people don't recognize that. I trained in the US, and there at Harvard, I recognize that progressive countries, first world countries, are taking heed of this, realizing that the population is aging across the world and that we need to take stock of it. We need to do something about it, because if we don't realize that it's going to affect our economy, it's going to affect our health systems, it's going to affect our society in general, it will happen to us and not something that we can navigate well. So I took it upon myself under the directorship of Dr. Duke, who is my medical chief of staff. He's been very supportive throughout the process to try and enhance the healthcare and the specific pathways that we have for older adults in the health system, because they are the highest users of the healthcare system in Trinidad and Tobago.
So what are some of the steps that one has to take to get that level of certification, to get that kind of certification? What is it that you have to do? What kinds of services do you have to provide? What kind of facilitation do you have to provide for the elderly?
Okay. So first you have to prove that you are taking care of a high burden of older adults. In our medical outpatient clinic, at least 50% of the population is over the age of 65 years old.
Okay.
So we would qualify for that standing. And then we have to prove that we are assessing all older adults that come through our clinic under the 4 main domains or pillars of age-friendly care. So these pillars are, the first important pillar is what matters to the older adult. So you need to tell us, healthcare is supposed to be a partnership. You have to tell us what your healthcare goals are, and we need to navigate that through our healthcare relationship. Then we have to think about the medications. A lot of older adults in the Tobago community, they are on herbal medications that might interact with the medications that we are prescribing. We need to make sure that's a safe environment for them and that they feel open and comfortable to tell us what you're on the French time, you're on the Wonder of the World. Let us know as healthcare providers, because that may impact the care that we're providing. And then we think about things like mentation. So after COVID, in this space of isolation that it created, Trinidad and Tobago, but specifically Tobago, has seen a significant uptick in the amount of patients with dementia. And it's being very under-recognized in the community. So we're trying to focus more on diagnosing and treating conditions that are more prevalent in the older adult population, like dementia, and depression also goes along with that. And then the fourth M, 4 M's of the pillars, the last M is mobility. So we need to make sure that we are providing safe spaces for older adults to mobilize, because mobility is one of the core functions in maintaining your independence as you age. So you have to prove that you are assessing for all of these 4 M's, these 4 parameters, yes, and you are addressing them each time you come into contact with an older adult in the community.
And talk to us a bit about how does accessibility play a role into the age-friendly reputation or standing of the facility. Because when we think about being age-friendly, a lot of the time, one of the main concerns has to do with that level of accessibility, making entry, exit easy for persons with mobility issues. Talk to us about that.
Yes, I'm very glad you brought that point up, because a lot of the time, the people that create these buildings and these structures, they're fit, young, healthy people. So they don't think about the challenges that older adults have to navigate on a day-to-day basis. Something as simple as the chair that you're sitting on. If there are arms on the chair, some older adults, they can't get up from a seated position without bracing themselves, because they've lost that strength in their thigh muscles. So we have, on a regular clinic day, we might have 20 people sitting in the waiting room. We have older adults with wheelchairs that we have to navigate into smaller hallway passages. So you have to be strategic about thinking about, where's the consultant sitting? Where's their room? Can the wheelchair access that room? And this shouldn't be something that is in hindsight. This should be in the forefront of every space that we're creating, right? Because older adults in the population, this is something that we all aspire to be, right?
Yes.
It's we all want to become older. It's a privilege to become older. So we need to make sure that we're creating spaces that older adults can function, they can mobilize, and they can feel comfortable in.
And concerning that, we have an outreach initiative coming up. I believe it's tomorrow. Tell us a bit about that outreach initiative.
Yes. So we embarking on this journey, it was quite challenging to get here, but we wanted to celebrate this achievement with the community.
Yes.
Because as you rightly said, this is the first age-friendly designated space in the Caribbean, right? There are over 5,000 age-friendly designated healthcare sites across the globe. More than 2,000 in the US, places in Europe, Asia. But there's not one in the Caribbean, and we are behind places like China and Japan. We are the second fastest aging population in the world. So I wanted us to start to shed some light on that. And I wanted the community to celebrate this achievement with us. So tomorrow at the Bell Garden Community Center, we are hosting a health fair. We're going to have games, door prizes. We're going to have free memory screening. We have a physical therapist, Dr. Vern Allen, is coming to do some examples of mobility exercises and so on. So we have a fun day planned tomorrow from 1 to 5 p.m. at the Bell Garden Community Center. So I really hope it's well attended so that we can keep the age friendly going.
Right, and remind persons that it's not just for persons in the Bell Garden area, but everyone on the eastern end of the island, or anyone who has the ability to.
Yes. Just like Roxborough Hospital serves a large community in the east, anyone on the eastern, anyone in Tobago, because we also have patients who make the trek all the way from Plymouth
Yes.
to come see us in Roxborough. I don't know why they do that drive, but sometimes they do. So anyone who's available and free between the hours of 1 to 5 p.m. tomorrow, if you can make your way down to the Bell Garden Community Center so we can celebrate this occasion.
Yes, I know a lot of elderly persons that really do come from the western end and go up to Roxborough to get their services done. But you mentioned something earlier that I'd like to go back and touch on, the dementia. You mentioned dementia and something else. I can't remember what it was.
Depression.
Dementia and depression coming out of COVID-19. Is it you're saying that the pandemic was the causation of the dementia, or is there another link to the dementia? What's causing that uptick in dementia?
So I can't say that it's a cause, but there's a direct correlation. So across the world, when we were told, rightfully so, to protect our communities, that we had to isolate in place, a lot of older adults isolated by themselves. And part of brain health is social connection. Right? So when older adults didn't have that normal day-to-day interaction that they might have had in the grocery store, if they're living alone, with a friend, it sort of breaks down the the mental processes in the brain, and it puts you more at risk of developing dementia. So across the globe, we've seen after 20 and beyond, we're seeing a steady rise in dementia. And we believe that part of that has to play in the way people were isolated during that time.
Okay. I know that a lot of persons, like, I used to sell in the market with my father on Saturdays. And a lot of the elderly, they used to look forward to coming to the market to socialize. Because for a lot of them, that's the only time that they could socialize with persons. You know, because they're living, as you said, they're living by themselves, the children are probably out of the country, or they have their own families, they don't really have time to visit them regularly. So that time in the market was a time for them to socialize. And as you said, because of the pandemic, persons would have, you know, all the avenues of interacting with persons would have been cut off for a 2-year period. So that was quite significant. In terms of trying to rebuild those community connections, those community connections, do you all have any initiatives or any plans or ideas towards trying to rebuild those connections so persons may not suffer with these conditions as much as they are now?
Yes, so that's an excellent point that you raised, and we do. So this is the first phase in a much broader vision and picture, right? So we want to create age-friendly communities, and we want to create these safe spaces for older adults to have these social connections. And tomorrow is the starting phase of that.
Right.
And hopefully, with the support of the executives, I am but a very small part in the rung of things, that we try to expand community outreach, we try to expand community social gathering and spaces, because it really, really, really impacts the well-being and the health, the physical health of our older adults. And we need to get back to that. We are becoming more insular as a society, and we need to start to think about having these spaces to have people, not just older adults, but young people as well. We need to create that connection in the community, because I find that's something that's severely lacking.
All right. Well, thank you very much, Dr. Naila Edwards. We really hope that you could have been here with us longer. We could have a more extensive conversation, but unfortunately, we have to end the interview there. We wish you all the best of luck with your outreach tomorrow. And say once again, congratulations on your designation as an age-friendly health system, the first in the Caribbean.
Right.
Thank you so much.
All right, ladies and gentlemen, viewers, up next we have Omar Abdullah, and he's going to be discussing with us the cargo shipping delays. We know there is some controversy surrounding Tobago Express, and we're going to delve into that on the other side of this break. But we have to go for some short messages, so do us a favor. Share the live, share the live, share the live. We'll be right back after these messages.